Okay, so in this video we're going to be talking about preventing injuries as a musician. We'll be looking at a few studies. All of the studies that I will be showing, I'll link in the description, but I'm probably going to be referring to a few studies that I don't have the reference to, simply because I ended up using a lot of different search words and time frames for finding all of these different articles, and I just couldn't dig up all of them. I couldn't find all of them again. There's not that much information, unfortunately, on this topic, so it was a bit of a mess to find all the information. So unfortunately, some of them I don't have the reference to anymore. If I do find them, I'll put them in the description as well, but worth noting. As a disclaimer, I'm not an expert, I'm not a doctor, but let's dive into it. So first of all, I actually wanted to try to get an overview of the topic and sort of summarize what the actual findings are, and then we dive into the studies themselves. So the first big finding is, unsurprisingly, that total playing and practicing volume is probably the biggest factor. However, it's also the most uninteresting one, because what we're actually trying to do is increase practicing volume without getting injured. Like, that's the whole goal. We want to get better, so we want to be able to practice more without getting injured. One thing that is worth keeping in mind, though, is that there are things other than playing your instrument that would add to this total volume. So to give you an example, if you're having problems with, say, your shoulder or your wrist, and you play a lot of computer games that involve mouse movement, it is certainly adding to this total volume, and by playing less of those computer games, you will be decreasing the volume. The second one is sudden large increases in volume / intensity, right? So this refers to, for example, going from 5 hours per week to 20 hours per week in a short period of time. It also refers to general inconsistency, right? So you want to play, say, 30 minutes per day, and then slowly increase that over a long period of time to, say, 3 hours per day, for the simple reason that your body needs time to adjust. So all of those big spikes, your body isn't prepared for them. You need to prepare your body to practice more. It's one of the key things to actually increasing the total amount you can practice, is to let your body prepare your body to practice that much by slowly increasing it, so it has the time to adjust. Intensity here refers to like how tense you are playing. So if you're playing a part that is really complicated to you, or if you're doing a lot of finger independence exercises that are you really tense up while playing them, you kind of can't help doing that. That's sort of what intensity is. So how hard it is to play, basically. Third one, not taking breaks while playing. That's a big one. They want you to take breaks at least every 30 minutes or so. Get up, get some blood flow going. Probably a good idea to switch between standing up and sitting as well while you play. The fourth one is lack of physical exercise. This refers to general exercise, so things like walking, swimming, jogging. It also does refer to more specific exercises, like for your shoulder health, rotator cuff exercises and stuff like that. Fifth one is lack of stretching. I think this is a little bit controversial. I'm not sure how much evidence there actually is for stretching helping all that much, but it is one thing they find. Sixth one is a general life stress. So this could be like having being in a stressful relationship, work situation that is really stressful. It could be poor sleep. It could be poor nutrition. It could be all of those. This is one that it contains a lot of stuff, and we're going to be trying to dissect it a little bit more later on. The seventh one is not warming up / down. So you should be warming up, and you shouldn't go from the peak of your playing down to no activity. This one is actually surprising that they stressed warming down as equally important, but apparently it is. And I suggest when it comes to warming up that you don't do it to a metronome, because when you play to a metronome, you're trying to match, and that makes you play more tense. So it's probably best to just warm up without a metronome, and then maybe do a warm up after your first warm up to a metronome. And usually warming up also includes stuff like going for a walk before you play. The eighth one is change of technique, right? So this one kind of ties into the second one, the sudden large increase in volume and intensity, which is that when you change your technique, your body is not adjusted to the new technique. Even if it's a biomechanically superior technique, your body just hasn't had the time to adapt. And so it's not the best technique for you right now. If you give your body time to adjust to it, then it will probably be better for you. Although we're all different anatomically. You might have some injury. You might have hypermobile joints like I do. That's going to affect your technique. If you try to copy my playing technique when I have my thumb bent on both hands, actually, that's not going to work. So if you change technique, and I mean, I think you should be trying to improve your technique over time, but you should not do drastic changes while maintaining the same practicing volume, playing volume. You should decrease your volume if you make big changes to your technique. The ninth one is bad technique posture. This one is a little bit controversial. So there's a lot of evidence on the biomechanical aspect or side of things. So we're like, there's less stress on your wrist if you keep it at a neutral position while moving your fingers. I believe a 60-degree angle was the worst. But just because it's biomechanically superior, it doesn't necessarily mean that it's a problem to not have them straight. There's very little evidence for the idea that technique is some huge important factor. There's not a lot on the rehabilitation side that I could find, and there's certainly not that finds much evidence for it being a big problem. But it's also the hardest thing to research by far. So I'm not surprised that there isn't that much. Considering how little actual scientific research there was into this, I'm not surprised that there isn't much supporting technique, even if technique would be to be really important, simply because of how hard it is to research versus other things. But we'll be going over at least one study, actually only one study that sort of challenges the importance of technique. So let's actually go to the first study here. This is an injuries prevention in string players looked at. This one looked at a bunch of studies and tried to draw conclusions. So here we have extrinsic factors we can find. So these are extrinsic injury risks. So large number of hours practicing or sudden increase in time of this instrumental practice. Lack of breaks during instrumental practice. Lack of training exercise in some of the several body segments involved in instrumental practice. So again, this is like training the shoulder cuff, stuff like that. I mean, rotate your cuff in the shoulder, whatever. Physical tension, which requires a relatively strong pressure executed by fingers or fingertips on strings and against the fingerboard. I tried to look up this study. I think I only found the overview of it. I couldn't find the whole study, so that was a bummer. I would have liked to see that one, but whatever. And then we have incorrect body position or posture. It's important to consider the fact that a good posture during instrumental practice would imply a transfer of body weight to the half front of the spine. Lots of musicians have these functions altered and they transfer their weight to their half back. Being this is one of the main causes of pain in the lumbar area. Yeah. One thing here worth pointing out is that the most common places that you find pain and injuries is actually, it's the back, lower back in particular, and neck area, followed by shoulders and then wrists. Those are the most, and then high psychological pressure exerted on the instrument player due to high level required during music interpretation. So that's on the stress end of things as well. And then they have exercises that they recommend or things they recommend that you do. This is kind of like warming up, but in general as well. So the first one is global exercises. So activities which facilitate a greater activation of the organism and the muscles during its execution. So walking, jogging, swimming. It is recommendable to practice them with exercise of joint mobility, flexo extensions, circumductions, rotations, abductions, and adductions. As we can see in the picture, which we don't have here, but For string musicians, would be recommendable a short walk, 5 minutes along the concert hall or dressing room, together with some mobility exercises on the upper extremities and trunk. In the following table are indicated the exercises that can be executed depending on the anatomic localization. Then we have specific exercises. Exercises directly related to the activity, that is to say, with the type of instrument. It's important to take into consideration the progression from low to high complexity. Right? So this, again, this is warming up basically and keeping it playing simple and then going to complicated. Stretching, there are several techniques and methods to execute stretching exercises. Among them are remarkable. So we have a bunch of different stretching methods here. You can look them up yourself. So yeah, those were the recommended exercises. Then we have this study here. This one looked at amateurs. So almost all studies looks at professional musicians, but this one looked specifically at amateurs, and it was trying to see the impact of a sudden increase in playing. So in this study, they went from before, let's see, where's the, so before 28% reported musculoskeletal complaints, so like pain and stuff, and it went to 80% over 1 week, over a 1 week period. Now, it's worth pointing out here though that just because they had pain after a week, that doesn't necessarily mean that there's going to be long-term complications, right? It might be that their bodies would have adjusted just fine. So this, it's impossible to say, are there going to be long-term problems or not? But it certainly tells you that if you make sudden increases, you should expect pain. 28 to 80%, that's a pretty drastic one. There's probably here how much they, somewhere in here, there's probably how much they increased their practicing time. You can look it up yourself if you're interested. Link will, as I said, be in the description. So this next one, just stressed the importance of warming up. So it just one looked at the, it was for string players again, and this one warming up before and taking breaks during the sessions protected. So it looked specifically at that and found that it did protect them from injury. This one, so the only consistent risk factor found in the 4 studies was being female, age greater than 18 years, weekly training more than 20 hours, training for more than 60 minutes without a rest or break, not having a habit of practicing sports, and playing despite the pain were also described as risk factor for musculoskeletal pain. And here we have, it was not possible to perform the meta-analysis due to heterogeneity of the studies. This is a common problem, I must point out, with these studies. There's a lack of meta-analysis because they don't use the same definitions for things, so there's no hard definition for what is. As an example, what is an ergonomic position? Or they use their own questionnaire, so there's no standardized questionnaire. So the findings that they find, you can't really do that much with because they're totally different from one another. So it's really hard to compare or utilize multiple studies to come to a conclusion, since they're all doing their own thing basically, which is always a big problem in science. So there are multiple pushes towards a more standardized approach, which hopefully we'll be getting in a few years, and then we'll get better data. And this one was just looking at pianists and hand size actually, and it found that the smaller the hand size, the more problems. And they speculate that this is because of the stretching. Like when you have a smaller hand, you need to stretch out more. This is tension, more tension. And of course, when you're more stretched out, you're weaker. So you need to push harder relative, like you need to exert more force relative to when it's in a strong position. So this one looked at orchestral musicians. And the risk factors found were change in technique or instrument, intense preparation for performance, preparation of a new and difficult repertoire, and prolonged periods of performance without rest. This one is the interesting one. So I managed to dig up the whole article. I have it here. I don't remember where the hell I found it, but it's out there for you to find. So first of all, this study, it made 3 main hypotheses based on the ergonomic problems with different instruments. So this looks at a sample of bass players, so electric bass players, double bass players, and then double bass players who play with a bow, and then of course it looks at those who play both as well. And the hypothesis they formulated around the ergonomic problems were, number one, that double basses have a higher prevalence of musculoskeletal complaints in the shoulder area related to the neck side of the instrument compared to bass guitars, because here the position of the left upper arm is elevated during playing, right? So you have it like you have your left shoulder, your left arm up when you play double bass, and that's considered not very good ergonomic position. If you have impingement in your shoulder, then that raising notion is gonna pretty much always impinge. So the second hypothesis was that bass guitars have a higher prevalence of musculoskeletal complaints in the wrist area of the box side of the instrument. The box side refers to the plucking hand. They called it box side because some people are left-handed, some people are right-handed, so they didn't use right hand. Even though most people are right-handed, so box side, that's the plucking hand, compared to double bass players, because of the extreme flexion position of the wrist during playing, right? So a lot of bassists play with their wrists in a non-neutral position. And then the third one is that German-style bowers have a higher prevalence of musculoskeletal complaints in the wrist area of the bowing arm compared to the French-style bowers, because of end range supination and less efficient force transmission of the hand to the bow. I don't know anything about bowing styles, but I know that there's like a hot debate in the orchestral scene about like one of them is considered less ergonomic than the other and hence should be thrown out or whatever. But all 3 of these hypotheses based on the ergonomic assumptions were rejected, as you can see here. All 3 hypotheses were rejected. This study shows that in this sample of professional bass players, long-lasting exposure to postural stress were not associated with musculoskeletal complaints. This challenges a dominant model in pain medicine to focus on ergonomic postures. So I believe there were 146 participants in this study. They do discuss, they have extensive discussion about what might and might not have led to this surprising finding. So if you can dig up this article and take a look at it yourself and download it if you want to read the discussion. But basically the authors, their conclusion is that maybe we need to challenge the ergonomic the idea that of the importance of ergonomic postures when it comes to injury prevention for musicians. So this sort of challenges the idea of technique being super important, at least to some extent, although it's just one study, so that's worth keeping in mind. I think it's not super surprising either. Like I think, like I said, we all have different anatomies, and there are many different ways to get like a somewhat ergonomic position, and my guess would be that as long as it's somewhat ergonomic and you don't have a lot of tension, it's probably not a big deal. And secondly, like, for example, the recommendation when you play electric bass is to raise your shoulder in order to get your wrist straight, right? The raising of the shoulder can be ergonomically bad, especially if you let it rotate forwards instead of locking it back. So that could lead to problems in the shoulder instead, quite possibly. But like this, it didn't find any problems with the right hand for or the plucking hand for electric basses compared to double bass or any of the other. So all the hypotheses were rejected. Anyhow, back to the overview. So like, what conclusions can we draw? Like, what are some of the things that we might want to think about. So obviously, you should keep some kind of track of how much you actually play, and also on other things that might stress that same part of your body. So the example I gave were computer games. There are a ton of other examples. Try to be consistent with your practicing. Go from 30 minutes to 40 minutes or 45 minutes to an hour, so forth. Keep increasing over time. You don't need to be a robot about this, but like just try to keep track of this, like broadly speaking at least, so that you're not all over the place. Just keep some track of it. Try to take breaks, probably at least every 30 minutes. I would also suggest probably switch between playing standing and sitting, because they stress the body in different ways. So probably a good idea. And when you play standing, there's less of a problem of bad blood flow. Try to go for multiple walks a day, most likely, and especially try to go for a walk before you start practicing, and probably walk around a bit when you're taking the breaks from playing. Implement stretching. That's good. Now, when it comes to general life and stress, I think there's a lot to say here. So one of the things that you might want to look into is to start supplementing vitamin D. Vitamin D is known to have an anti-inflammatory response. So is vitamin C. So that's another one that you probably want to supplement. Also, vitamin D is really important for absorbing calcium. The other vitamin that is really important for calcium absorption is K2, vitamin K2. So vitamin D absorbs the calcium to the blood, and vitamin K2 sends it to the bone. And of course, having strong bones is really important for not getting injured. So you might want to, that's another reason besides the anti-inflammatory properties that vitamin D has, that you might want to supplement vitamin D and maybe K2 on top of it. Sleep is a huge one. That's super important for recovery. And the thing that we need to think about here is that the human body is not like a car where if you have friction, eventually something will break. Like it will tear, and then after a certain amount of time, it will break. The human body has inbuilt repair mechanisms, and it's this interaction between tearing down and repairing that actually gets you stronger. So as long as you are repairing more than you're breaking down, you're growing. And sleep is huge for repairing. So if you're having sleep issues, then absolutely the first place you should probably look at is by trying to sort out your sleeping. Another thing when it comes to stress is, again, general exercise, stuff like walking, jogging, just general physical exercise is really important for decreasing stress in your life. Warming up down. When it comes to changing technique, you should do it responsibly. So I'm not saying you shouldn't try to change your technique. I encourage you to play around with your technique and make it more efficient, but you should do so very responsibly and not probably decrease the volume of how much you're playing when you make serious changes to your technique, so your body has time to adjust to it. I will also say that I think it's really, really worthwhile to do resistance training, in particular stuff that helps your posterior chain and the back of your shoulder. So things like deadlifting, things like training your rotator cuff, things like pull downs, any rowing type of movement. Those are probably really beneficial. Things like things that help your wrist, but the wrist you should probably be a little bit careful with, so keep that lighter. I don't think heavy benching is going to help you stay safe. That's probably just going to fuck you up, because that pulls your shoulder forwards and also is really hard on your wrist. So that's probably not in your best interest, but you should practice your wrist, but do it like with lower weights, and same when it comes to resistance training, of course, start easy, gradually increase. And in this case, since we're doing it for, well, presumably doing it for injury prevention, we shouldn't go too hard in the gym. That's not ideal for injury prevention. That's ideal for getting stronger and building muscles as much as you can. Now, there was one more thing I wanted to look at, and that was this research article. So this research article was trying to establish if there's a good exercise routine for preventing injury and as well as recovery. And the results was that no evidence-based literature regarding an exercise program for professional orchestral musicians was found. An exercise program was subsequently developed with progressive stages that followed an adapted exercise prevention and rehabilitation model. The blinded ranking of each exercise series produced varied results, particularly in the abdominal and shoulder series. We can scroll down here. They don't have all of the specifics here, but we have neck series, shoulder series, spinal series, abdominal series, hip series, warm up and cool down. So again, cooling down and warming up. So next series, progressions of cervical spine exercise therapy, strengthening the deep neck flexors and extensors were adapted for musicians. In the final stages, varying degrees of resistance was applied to the neck from a variety of angles to load the deep neck muscles system in an attempt to replicate the challenges of maintaining a healthy neck position while sustaining the weight of instruments. Shoulder series. A progressive series of scapular stability and rotator cuff exercises were included, focusing on restoring shoulder muscle balance and movement control. This progressed to stages that added resistance and increased the functional context of the exercises into instrumental performance biomechanical patterning. Can't even pronounce that. So rotator cuff is, I think I need to stand up for this. It's when you keep your, that was actually a really bad demonstration. My shoulder was fucked. But you keep your elbow up against your body and you rotate it outwards, your arm outwards, while keeping your shoulder in a, retracting your scapula and stuff like that, which I didn't do, but whatever. Then we have spinal series. The early stages of the spinal series consisted of low load activation of the lumbar multifidus. You can Google that and look into it, but this is a lot of stuff like yoga type of stuff. It's rotations. It's like, yeah, I mean, you can look up the specific exercises that are recommended in therapy for strengthening these kinds of things. Later stages progressively integrated the lumbar multifidus into a range of more functional activities with appropriate use of load and a variety of external perturbations to make the movements used during performance. Then we have the abdominal series. So you can see it focus on the neck, on the shoulder, on the spine, on the abdominals, on the hips. Abdominal series. A focus on activation of the abdominal muscles during commonly prescribed clinical Pilates exercise was included. Progressions into more difficult stages using an unstable base of support. Finally, these exercises were adapted into more functional activation patterns in both sitting and standing. I think one of the things that interesting thing to note here, when it comes to the shoulder, can I find it here? Yes, here we go. Proximal stability at the shoulder has been shown to be important for increasing hand dexterity and strength. This is an important point, that just because you have problems with your wrist, it doesn't mean that the problem actually is at the wrist. It could be poor blood flow from your shoulder area that is actually causing the problems, because in order to recover, you need to remove waste products and you need new nutrition to come to the area so that it can recover and build stronger. And so if your shoulder area is fucked up, that can really decrease blood flow, and that can mean that you recover poorer, and therefore you end up just tearing down over time instead of actually building up. So the problem doesn't have to be in the wrist. Just because you have pain in the wrist, it could be coming from the shoulder. Yeah, it's not always that simple. I think that's it for the overview. just keep in mind that these things tie into general health. And also that we're all individuals. Our bodies are not anatomically the same. That's why doctors treat patients and they don't just have like a big questionnaire and then you answer the questionnaire and then you're prescribed medicine. They actually check you out in person. Again, because you might have some wonky stuff going on that is unique or fairly unique to you that means you need a different approach. So you should listen to your body and you should be conscientious and track changes and see what works for you and what doesn't work for you. There's no one size fits all. You need to stay on top of things. If you're having problems, seek out professional help. But these are an overview of things you might want to keep in mind and things you might want to try to implement in order to stay safe and avoid injuries and be able to increase the total amount of time you practice without getting problems. So that's it. Thanks for watching.